My name is David. I am an RMT. I currently work here at PhysioMed, and today we're going to be treating lower back pain caused by sciatic impingement. So, at the beginning of the treatment, I address the lower back with some jostling and some compressions. This is to increase blood flow and help get movement in the lower back. Then to treat the piriformis itself, which is like a pizza-shaped muscle attaching from the sacrum, attaching into the greater trochanter of the hip. Fiber direction is in this direction here. And generally I work with, at first, the gluteal muscles, working of the insertions with compressions. And then to treat the piriformis itself, I may start at the greater trochanter and do cross frictions across the fiber, working up to the sacrum itself. I then can work with the fiber direction of the muscle, down to where it inserts into. I then can treat the hamstrings with some Swedish to increase blood flow to the area. And after treating that, I would do some stretches, pin stretches of the hamstrings themselves. And then finish off with nice long strokes.